We tell the patient also, B-cell. So what is the patient is going to understand B-cell and all that? But we'll definitely look forward, sir. We'll just have this panel discussion over. If you have some time, you can listen to these people. And I'll start with Dainath Shukla. He has come all the way from Ahmedabad. He has some case to discuss. All yours, Dr. Shukla. He is basically MBBS. He has done his MD in rheumatology. He looks young, but he has got a potential. Please.
This is a very pretty simple case actually. I'm just discussing it to understand what the opinion of the panel and the house is. So let's get back to the business directly. Let's start a case. So it's a case of 24-year-old female Mrs. MMM, recently married. At that time, at the time of presentation in 2021, she was having 1-year history of multiple joint pains with early morning stiffness with no extra-articular manifestation or no features suggestive of connective tissue disease. And joints were all tender and swollen. Family history, mother also has diagnosed rheumatoid arthritis. Patient had COVID 6 months back and she took COVID vaccine second dose 3 months back. I would not have paid attention even to this history because this was a norm at that point of time. And this was according to national guidelines. So next please. So after this she has been investigated thoroughly for this. And CBC was suggestive of anemia of chronic disease. RFT, LFT were all normal, and rheumatoid factor and anti-CCP both were strongly positive. So she has been also labeled as a case of rheumatoid arthritis like her mother. And as per ACR recommendation, American College of Rheumatology, she has been started on methotrexate 15 mg once a week and hydroxychloroquine 300 mg in the evening. But unfortunately, she couldn't tolerate oral methotrexate at this dose. Disease was also quite active. She started developing nausea, vomiting. She has been given trial of divided doses. She has been given even injectable methotrexate, but somehow she couldn't tolerate it. So switched to sulfasalazine because she wanted to get pregnant too because she was recently married at that time. So next please. But after starting sulfasalazine, she got something called DRESS, drug-related eosinophilic systemic symptom के साथ this kind of a sulfa reaction. She has been treated with steroids for quite a long time. And then again her disease became active after stopping steroid. So she has been offered leflunomide, but she's not willing because she has read about it. She's from a very affluent family of Ahmedabad. So she did read about leflunomide staying very long in the body and affecting the pregnancy. She was not ready to take it. So the plan was to start tofacitinib. But yeah, next please. So tofacitinib considered, but again as she was reading too much, so currently tofacitinib can be started even without herpes zoster vaccine. One of the very important side effect of tofacitinib is you catch herpes zoster infection. And herpes zoster vaccine as per national schedule is recommended at 50 years of age or older. But in tofacitinib in selected cases, immunosuppressed cases, it can be taken. So she insisted for it. Her doctor advised it 2 doses taken 2 months apart. But then she, while visiting her cousin's marriage, she got sudden weakness and she got all 4 limb paraparesis kind of a thing. And it was diagnosed to be GBS. Unfortunately, in very remote area where the marriage was, NCV etc. was not available, so it was never confirmed, but she has been treated with IVIG and she got better. Then this is what was quiescent for quite a long time. She got pregnant. In pregnancy is a known immunocompromised state, so she remained quiescent for a while and then again flared up. So now she is seeking her opinion. Yes, please, next. So she got severe flare and now she is seeking her opinion because already hydroxychloroquine is ongoing, tofacitinib is ongoing, and she is having severe flare of her pre-existing condition, which is rheumatoid arthritis. So now biologic therapy is being considered rituximab versus adalimumab. So this is how rheumatoid arthritis is being treated in a normal allopathic clinic of this country. Can this audience or panel suggest something new? Because I have few questions here which I would like to ask to the panelists. So first of all, let's go to the very basics. Is rheumatoid arthritis purely genetic? If it's genetic, is it just genes or so-called hologenome? I mean, I'm talking about gut microbiome and everything. And if it is, again, if there is a role of gut microbiome, which is now proven beyond doubt, so I will talk more about it. But can diet really help changing the gut microbiome? Because there are papers which says it cannot. So then role of environment trigger, like diet, vaccine and pollution. So was there a connection with pre-existing, she had COVID vaccine taken. She also had this herpes zoster vaccine taken. So was GBS connected to herpes zoster vaccine? That's also a question I would like to ask. And what could have been a different approach in the treatment since beginning? Because it was as per all Western guidelines and proven data, so-called data. How to balance immunosuppressed state and risk of infection? Was really herpes zoster vaccine needed? Was other vaccines needed or not? And could everything have been avoided altogether or not? Because as you will see, clearly seen that she has suffered lots of consequences of treatment also. It's not just the disease. So has anything been done differently to avoid this whole situation? So I'm putting it up for the discussion.
We'll do one thing. This is Dr. Sunita, Dr. Anusha, and Dr. Kaur. This case requires some kind of, it's called manthan in Hindi, because what happens is the patient comes for this one, and the treatment what we are giving is sometime fires back. And we see usually some reactions and all that. In our allopathy, we always face reactions. It is not that, and we anticipate also. We try to see whether penicillin test is done. We try to see whether we have got G6PD done or not. So, but sometimes having something like GBS, Guillain-Barré syndrome with paralysis and all that, it is slightly frightening for both the patients. And this is the precise reason we thought, let us take the help of something around, something like what Dr. Mili is doing, ozotherapy or some hyperbaric oxygen, trying to see how best we can serve this particular thing. So, Dr. Devan, there are a lot of open-ended questions. We are not here to debate on that. What we will think is what best still can be done. Dr. Sunita Kaur, I think you can take up this, start with this, how you can work it out. What is your approach for any autoimmune disease, what you get? Because I know you're a master in autoimmune, and please.
Thank you, Dr. Saxena. When we discuss autoimmune disease, we need to look first at the gut. So when we are talking about the gut, we need to understand you have to divide the gut into two sections. One is the gut wall, which is the integrity of the gut, and second is the content of the microbiome within the gut. Now, why we end up with a lot of problems with autoimmune diseases is that we don't eat vegetables anymore. The reason why we end up with an autoimmune disease is, where do we get our microbiomes from? Just answer that one question, you will answer autoimmune disease. Where do we get our microbiomes from? Anyone? Soil. So we get our microbiomes from the soil. Nature has planted a vegetable onto the soil which will absorb the microbiome into the soluble and insoluble fibers. Now we have to eat this soluble and insoluble fibers. That's why fibers are so important in the gut, because it's from the soluble and insoluble fibers that the microbiome is released. Now, when you take vegetables and you cook it at any temperature above 42 degrees, those microbiomes are going to die. So when we cook our vegetables, when we make saag, when we make palak, when we make vegetables that is already been cooked, we do not get the microbiomes. So eating vegetables in its raw form or in juicing the fruits and vegetables, you will get the microbiome. Now, one thing you need to understand, there is a difference between a fruit and a vegetable. Vegetable will absorb its nutrients from the soil. A fruit will have its insoluble fibers become soluble fibers by the process of digestion, digestive enzymes. Okay? The microbiomes mainly come from the soil. So when we have a patient who has got an autoimmune disease, the first thing you need to ask this patient is how much of raw vegetables that they have taken. And if they have not taken a variety of 40 to 50 types of vegetables, you will not get that variety of microbiomes. Okay? Now, one other thing that we need to understand is most of our fruits and vegetables now has got something called glycophosphate. And that is the problem. Glycophosphate is the one that destroys all your microbiome in the gut. And when that glycophosphate destroys the microbiome in the gut, you do not have neurotransmitters, you do not have postbiotics, you do not have all the metabolites that you need to keep the gut intact. So first question, when a patient comes to you is, you need to know what is the type of feces the patient is producing. Okay, so you've got the Bristol stool chart. You look at the Bristol stool chart. If the patient does not have feces that looks like a banana, at least once or twice a day, that patient is going to have a problem with the microbiome. So the fastest way to replace a microbiome is going to be with your probiotics. What I normally use will be something called lactospore. Lactospore is a patented microbiome here in India by Sabinsa. It helps with the gut integrity. So when you get your gut integrity intact, your blood-brain barrier also, the integrity becomes intact. Your skin barrier, all cell membrane is affected by one microbiome called Bacillus coagulans, which is patented as lactospore. Now that lactospore keeps the integrity of the intracellular junctions intact. So now you don't have transfer of material from where it's supposed to be to where it's not supposed to be. So your immune system doesn't mount a reaction against the protein that is being transferred. Once you have that integrity intact, you need to replace the microbiomes. The reason why Dr. Saxena gave me this mic is because there is two types of microbiomes which you can replace commercially in capsules. You will get active form and you will get the spore, okay? But nobody tells you that the microbiome in your gut only lasts 4 days. So whatever you get in that bottle, which comes at 2000 CFU or 2 billion CFU, you will get hardly anything left. Me, in Malaysia, we stand at 35 degrees Celsius. Can you imagine how many microbiomes will be dead before it gets into the gut? Okay? So the initial treatment is always microbiome replacement with a variety of microbiome. Now, if you want to know what microbiome deficiencies you will have to do a stool test. The stool test will give you the type or the species of microbiome which is deficient. Then you replace with whatever you can. But the key here is the only way to sustain microbiome replacement is by eating your vegetables, and that too in raw form. Any temperature above 42 degrees will destroy all the microbiomes. Okay? So if you can keep doing juicing of fruits and vegetables on a regular basis every day for a period of 2 to 5 years, you will see that the patient's microbiome will be replaced. You can do a stool test and you will see the microbiome being replaced. Okay? So the easiest way to do this for a prolonged period of time is going to be juicing fruits and vegetables with a slow juicer, because the temperature of that juicer has to be maintained.
I got one from Malaysia. The juicer is different actually. What juices what we use in India, they are based on some heavy temperatures goes up.
Correct.
So you need to have a specific.
The brand is called Cooings. Cooings.
Cold press juicing.
Cold press
So
juicing.
the traditional way, the ganna juice was made is a cold press. So otherwise what happens is we use a lot of centripetal force. We're stripping off the surfaces. When we strip off the surfaces, we denature that protein.
Forget about denaturing. The simplest way is ganna juice, what he said. Have a ganna juice with a machine, have a ganna juice with a traditional way. There's a difference in the taste and the texture, everything. You can immediately identify that.
Yeah, but we are the consumers, we are into it. We go with the branding. Yeah, please.
So the fastest way, if you have a very severe patient with a lot of reactions all over the body, right? The only way to replace the microbiome fast enough is going to be a fecal transplant. So if they have companies now that have put fecal powdered into capsules. You just swallow the capsule, okay? But fecal transplant will probably be the fastest way to replace the microbiome. Unless the patient can tolerate orally or juicing, that will be the only way to sustain long term. One last point before I stop is when you get your fruits and vegetables from hydroponics, do you think there's any microbiomes in there? So microbiome, you ingest it, it goes into the gut, and from the gut it passes out as feces. That feces is supposed to go back into the soil to be converted into microbiomes. Whatever we get in hydroponics is only chemicals. There will be some form of microbiomes, but not as much. So if you replace the gut microbiome with vegetables from hydroponics and you do a stool test, you will see it doesn't get replaced. Okay, thank you.
I think this is